result in some lessening of muscle tone, which should be largely recovered before you assume full responsibility for your home. There is at least a 6-week period of adjustment ahead for the organs, which have undergone special changes during pregnancy. While in hospital, you will have a balanced diet and rest. With the approval of your doctor, you may learn exercises to strengthen the abdominal wall and pelvic floor. It is important to continue this pattern of living when you get home. Make sure that you get 8 hours sleep and a half hour's complete rest morning and afternoon. If possible, continue with the exercises taught in hospital and keep in mind what you have learned about standing, sitting, moving, and relaxing. Get some help with the housework or drop some of the less important jobs for a while. Don't add the work of caring for your baby to what you normally do. You may take a sponge shower bath or tub bath, whichever you prefer. A walk in good weather can be a refreshing diversion. Exercise and fresh air are good for you. If you are nursing your baby, your diet should be much the same as during pregnancy. Drink 5 glasses of milk a day. Many mothers find their thirst increases when nursing. Drink at least 3 glasses of water daily. You may make up the milk consumption in puddings or soups, but don't let the fluid intake reduce the amount of other required foods. A balanced diet, rich in iron and proteins, is good for you and good for baby. Now that baby's home and is all yours to care for, let's size him up. He's smart enough to recognize and respond to mother's feelings. Try to avoid showing worry or anxiety. Be positive and loving with him. The soft spots on the top and back of your baby's head will gradually close as bone grows across them. He can't distinguish objects yet, and he hasn't learned to focus his eyes. He likes being touched and comfortably wrapped. Learn how to lift and hold your baby properly. One hand under the lower back and buttocks, the other around the neck and shoulders. Many babies enjoy bath time. If your baby doesn't, make his bath time short until he learns to like it. Babies are born with a secretion on the body which will wear off in a few days. Check with your doctor or clinic as to when you should start bathing your baby. In any case, the creases should be cleaned with clear water applied with a soft cloth. You will need a comfortably warm room with no draft, a table surface at hip level, and a basin or baby's bath. The rest of the equipment should be within easy reach. Baby's face cloth and towel, covered jars for whisks of cotton and absorbent cotton, a covered dish to hold closed safety pins, and a cake of mild soap for baby. Clean clothes to put on after the bath, a newspaper for soiled clothes, a paper bag for waste. Bath water should be about 100 degrees. If you haven't a thermometer, test it with your elbow. It should be a comfortable temperature. Now you're ready to start. After washing your hands, spread a towel on your lap or on the table if you prefer standing. Wash the scalp with soap applied sparingly with your hand. Rinse thoroughly. The crust, called cradle cap, is less likely to appear if the baby's head is properly washed and dried and no soap is left on it. Baby keeps his nostrils clear by sneezing. Clean them only if there is something which has to be removed. Use small pieces of absorbent cotton, tightly rolled. The outer ear may be cleaned with a small piece of absorbent cotton. Wash his face with water only, no soap. Avoid covering his nose and mouth at the same time. The eyes require no special attention. Dry his face with gentle patting, not rubbing. Notice that one garment at a time is removed so as to keep the baby warm. You don't need much soap. The lather can be easily picked up with one hand. Be sure to rinse off the soap thoroughly. Remember to pat dry. Now, put on a clean shirt to keep him warm during the rest of the bath. Don't forget to wash well between the creases, rinse, and dry well. genitals with a piece of moistened absorbent cotton. If you use powder, lotion, or cream, apply it with your hand. Don't shake powder on. The baby might breathe it in. A boy needs extra diaper thickness at the front, and a girl needs it at the back. For a tub bath, be sure to lower him in slowly so as not to frighten him. Keep a good grip on him with one hand while you wash with the other. Always remember this: never, under any circumstances, leave a baby or small child alone in a bath or on the table, even for a moment. If the baby is a girl, be sure to clean between the folds of skin around the genitals. In either case, make sure baby is thoroughly dry in the creases. Feeding time is the greatest event in the young baby's life. As well as the all-important nourishment, he gets a feeling of security and well-being from his close contact with you. First, diaper the baby so he is comfortable. Wash your hands carefully. If you are in bed and breastfeeding, lie on your side with head and back comfortably supported and facing baby. Support him comfortably with your arm. Guide the nipple to the side of his face nearest the breast. He will automatically find it without any help. Use your finger to depress the breast as needed so he may breathe comfortably. If you are nursing the baby sitting, a comfortable armchair which supports your back and arms is best. Baby will be comfortable on the pillow with your arms supporting his back as his head rests in the crook of your elbow. You may find that a footstool makes you more comfortable, more relaxed. During the first few days, the actual nursing time should be limited to about 5 minutes. After the first few days, the nursing period may extend to half or 3/4 of an hour. Different babies nurse and rest at a different rate. It takes time to establish nursing, so persevere. He falls asleep during the early part of the feeding. Waken him by stroking the cheek next to the breast. If he falls asleep near the end of the feeding, he's probably had enough. Halfway through, and at the end of the feeding, burp him like this, patting or massaging the middle of his back. It's a good idea to put a diaper on your shoulder in case he spits up a little. If you are bottle feeding, warm the bottle in a saucepan of water on the stove, or perhaps you have a bottle warmer. As it warms, shake the bottle and test its temperature. When it feels the same temperature as your wrist or the inside of your elbow, it's ready. The formula should drip regularly from the nipple. It shouldn't pour. If the hole is too small, open it with a red-hot needle. Use the same comfortable armchair and hold the bottle at an angle like this so that no air passes through the nipple from the bottle. Now, sit back and enjoy your baby for the next few minutes. And don't forget to burp him. Sleeping is what baby will do most of at first. Get him ready for it by changing the diaper, a fresh shirt, and a nightgown. Later, you will use sleepers. Use a firm mattress with plastic cover under the sheet. No pillow, blankets as needed, no drafts. Change his position in bed from one sleeping period to another. Comfort and warmth. Sleep well, baby.